Hi students, continuing with the suspension or dispersion system of aerosol, there are various disadvantages present due to the application of the co-solvent, as co-solvent was applied in the previous two systems. In one-phase system, there dispersion of active ingredients is done in propellant or mixture of propellant. To overcome this disadvantage, that is, to reduce the rate of settling of the dispersed particles, different type of surfactants are added. Mainly, the suspension or dispersion system is used in oral inhalation. Like in epinephrine barbiturate, they are having less solubility, this denotes less solubility in propellant. So, sorbitan monoaleate is added as a surfactant. Now, physical stability of aerosol will be dependent upon certain factors. Includes number one, the moisture content should be optimum. Sometimes, if the active ingredient is not properly soluble in the propellant, certain derivative of the active ingredient may be used. Then, the particle size should be reduced less than 5 micron. Then, there should be less difference in density between the propellant and the suspensoid. Then we can use dispersing agent that will help to disperse the active ingredient within the mixture of the propellant. If particle size may agglomerate, it will change the solubility and the moisture content, and the particle size growth will be there. Now, if the particles aggregates become massive, caking will be formed, and this aggregation increase with increase in temperature. Now, aggregation adheres to the wall of the container and it will lead to the valve clogging. So, once the actuator is being pressed, the proper dose will not be coming out. There will be an inaccuracy in dose. That's why lubricant should be used. The moisture content of the aerosol container should be less than 300 ppm. It should be controlled, otherwise the propellant or the suspensoid may get aggregated. The material suspended in the vehicle in which they are partially soluble can develop this type of size growth. To reduce this type of disadvantage, certain derivative of the drug like ester formation, chelate formation can help in the solubilization of the active ingredient into the propellant. Again, the physical stability of the aerosol depends on the aggregation. It should be kept in mind that the initial particle size of the aerosol should be within the limit of 1 to 5 micron. If there is less density difference between the propellant and the dispersed phase, then the rate of settling down will be less. This can be done by either adding of a third substance that is having equal density with the propellant. Okay, so this will create a less difference density and the particles will be easily solubilized with the propellant. Sometimes surfactant can reduce the aggregation, like isopropyl myristate. They also act as lubricant. The effective concentration of isopropyl myristate is 0.01 to 1%. Next comes the foam system. It consists of active ingredients, aqueous or non-aqueous vehicle, surfactant and propellant. It can be dispensed as stable or quick breaking foam. Depends on the nature of the ingredient, whether the foam will be stable or not. Aqueous stable system is used mainly for dispensing antibiotic and steroids. Non-aqueous foam system, here the vehicles are used different type of glycols, and quick breaking foam, propellant is there in the external phase. That's why when the actuator is being pressed, the propellant come out as external phase and it get vaporized. So it can dispensed as a foam, and once the pressure is get released, it collapses into a liquid. Mainly they are used in topical purpose.